preemiehelp.com. 85% of infants that are born at less than 750 grams of weight eventually are born with chronic lung disease, compared with only 5% that are born at 1,500 grams or heavier. Today, I'd like to give insight on how much extra work and how much extra care it requires to take care of a preemie infant. First, I want to talk to you about some of the challenges. When a preemie is born, they typically require a much longer stay in the hospital than any normal newborn. Most newborns stay in the hospital for about 2 to 3 days and then they get to go home. Well, from experience, I know that my preemie had to stay in the hospital well after the 2 to 3 day mark. Upon birth, most preemies are admitted into the NICU pretty much right away. When I had my daughter, she was taken pretty much immediately, and I got to hold her for a few minutes before she was taken back so that they can be checked out by the neonatologist and have any tests run that may need to be run to make sure that the preemie is actually a healthy baby. According to UCSF childcarehealth.org, most very preterm infants are released out of the hospital until their due date. Preemies require longer hospitalizations, and they are actually more likely to develop health problems. There are quite a few different health problems they're more susceptible to. One of them is bronchopulmonary dysplasia. According to parenting.com, bronchopulmonary dysplasia is chronic lung disease due to damage of the immature lung at birth. There is treatment for this disease, however, which includes increasing the oxygen supplies to baby with like an oxygen mask put on its face or the tubing in its nose, replacing the breast milk with a special formula that adds extra calories for the infant, and possibly restricting fluid given to the baby and using a bronchodilator to keep the lungs open. These treatments are actually only necessary until the preemie's lungs are healthy enough and able enough to heal and be strong and function on their own without any help. Another disease that preterm babies develop is retinopathy of prematurity, or ROP. ROP is damage to the retina caused by an imbalance in the blood's oxygen level or extreme prematurity, is the definition that parenting.com gives. It's determined whether a preterm infant has this disease by going to an eye exam with a pediatric ophthalmologist, and they determine whether the infant has ROP. And in the case of the preterm infant having ROP, they have to have surgery to correct it. Otherwise, they'll become blind. Along with the many health problems, preemies also need more time and attention. When they're born, they can be extremely small, like in this picture. This baby's not even the size of his parent's hand. That can cause health problems, health risks, and obviously a baby this small is going to need plenty of time and attention. They might be a little bigger, but have lots of machines on them. And when you have that many different machines hooked up to a baby, you obviously have to spend much more time caring for and making sure that all the equipment it needs to survive is working and functioning. Preemies bring a whole new meaning to caring for infants. Not only are they more work, more time-consuming because of their health problems, you also pretty much have to keep preemies on a regular feeding schedule. It can be every 2 hours, 3 hours, 4 hours. It just depends on what your neonatologist tells you upon leaving the hospital. They'll start this feeding schedule in the hospital and do it around the clock, and they expect the parents of any preemie to follow exact rules and instructions that they give, especially for their feeding. Preemies have to have a feeding schedule because they weigh less and are smaller than any newborn their size, and they have to have more food and more calories to help them to grow and to catch up. Personally, when I had my preemie, she was fed every 3 hours. Even in the middle of the night, I had to set an alarm for 3, 6, 9, and 12 a.m. and p.m. so that I could make sure that she was fed and had all of the food and nutrients that she needed. Most parents that have preemies want to compare their preemies to other children their age, but you can't do that because technically they're not even born yet. You have to go by their gestational age. You can't just go by they were born this date and they're a month old, they should be doing what other 1-month-olds are doing. It doesn't work like that. If your preemie is 6 weeks early, then when they're 6 weeks old, they're just now a newborn. It's like they were just now born. So you would compare them to newborns. You wouldn't compare them to any other 6-week-old baby because they're probably not going to be doing the same things. If the baby's born at 30 weeks, it's going to take until they're 10 weeks old before you technically have a newborn. That being said, when you have a preemie and they are a month old, you can't compare them to other 1-month-old babies. You have to keep in mind what their gestational age is and actually how old they should be, not how old they are. Like I said, preemies, they're more difficult, but they're also just as much fun as any full-term baby. You might hear stories of preemies who can't do this or they can't do that, and it probably is true. They have more restrictions on what they can and can't do, but who's to say you can't have fun with your preemie in your own home? Just because you might not be able to take your kid to public for fear they might get sick because they have a weak immune system, you can do lots of fun things with the newborn at home. You can, teach them to roll around if they're old enough to roll. You can teach them to do mild stepping stones that every child has to get to eventually, but you just have more time to work on because you're not going everywhere. You're not going out places all the time. And I think bonding with your newborn is more important than taking them for the world to see anyway. You want to cherish the time you have with your infant, especially if they're preemies. Altogether, all preemies are admitted into the NICU. Most stay for a while, depending on how severe their premature birth was, or if they're on feeding tubes or oxygen tubes, or if they're not on anything at all, or just depending on how their health is when they are born, depends on their stay. Yes, they do need more attention because they have, rules, you could say, to go along with them that most babies don't have. But, they're just like any normal infant. You just love them and care for them the way they need to be loved and cared for, and they're really no different. In the end, it's just they're the same. You have to love the braveness and the fighting that preterms put in to be able to make it through in this world versus being born with a clean bill of health. Preemies are fighters. Even if a preemie is born with absolutely no health problems, they are still premature. They are fighting their way to make it, and all of their difficulties are thrown at them at such an early age in life. And it's just important to remember that they're small, but they are fighters and they are very brave.